Good day, good afternoon, good evening, wherever you are in your part of the world. This is King B with another important video. Well. So you see the title on the screen. Just in case antibiotics widely overused during COVID-19, says UN Health Agency. So I am on the United Nations website doing some digging and doing some research, trying to find some more information about this document, this UN document or declaration. And I found this not video, article on their website. So let's dig into this. And this was published yesterday, April 26, 2024. All right, so it says antibiotics saw extensive overuse globally among hospitalized COVID-19 patients during the pandemic without improving clinical outcomes, while also potentially increasing the already serious and growing threat of antimicrobial resistance from superbugs, the UN World Health Organization said on Friday. Wow. And an alert who noted that although just 8% of hospitalized coronavirus patients also had bacterial infections, which can be treated with antibiotics, a staggering 3 in 4 were giving them on a just in case basis. At no point during the global pandemic did the UN Health Agency recommend using antibiotics to treat COVID 19, insisted WHO spokesperson Dr. Margaret Harris. Viral, not bacterial. The advice was very clear from the start that this was a virus. So it wasn't that there was any guidance or any recommendations that clinicians could go in this direction. But perhaps because people were dealing with something completely new, they were looking for whatever they thought might be appropriate. According to the UN Health Agency, antibiotic use ranged from 33% for patients in the Western Pacific region to 83% in the Eastern Mediterranean and the African regions. Between 2020 and 2022, prescriptions decreased over time in Europe and the Americas, but they increased in Africa. Last hope. Data compiled by WHO also indicated that most antibiotics were given to critically ill COVID-19 patients at a global average of 81%. Antibiotic use in mild or moderate infections showed considerable variation across regions, with highest use in Africa at 79%. Worryingly, the UN agency found that the most frequently prescribed bacteria busting antibiotics globally were those with higher potential for antimicrobial resistance. When a patient requires antibiotics, the benefits often outweigh the risk associated with side effects or antibiotic resistance. However, when they are unnecessary, they offer no benefit while posing risks, and their use contributes to the emergence and spread of antimicrobial resistance, said Dr. Sylvia Bertagnolio, WHO Unit Head for Surveillance, Evidence and Laboratory Strengthening Division for AMR. No positive impact. The UN agency report maintained that antibiotic use did not improve clinical outcomes for patients with COVID-19. Instead, their systematic prescription might create harm rather, for people without bacterial infection compared to those not receiving antibiotics, WHO said in a statement. These data call for improvements in the rational use of antibiotics to minimize unnecessary negative consequences for patients and populations. The findings were based on data from the WHO Global Clinical Platform for COVID-19, a database of anonymous clinical data from patients hospitalized with the coronavirus. Data came from 450,000 patients in 65 countries from January 2020 to March 2023. Superbugs. Antimicrobial resistance threatens the prevention and treatment of an ever-increasing range of infections caused by bacteria, fungi, parasites, and viruses. It occurs when these bacteria, fungi, parasites, and viruses change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illness, and death. As a result, the medicines become ineffective and infections persist in the body, increasing the risk of spread to others. Antimicrobials, including antibiotics, antivirals, antifungals, and antiparasitics, are medicines used to prevent and treat infections in humans, animals, and plants. Microorganisms that develop antimicrobial resistance are sometimes referred to as superbugs. Yeah, so um, this just this just wow. So they was giving people um, antibiotics that didn't need them, and that's just created a situation where now you have these superbugs that develop um, more of a resistance. So I mean, this sounds intentional. I mean, this is my opinion. This sounds intentional. You know, it definitely sounds intentional to me. That's just my opinion. But again, I came across this article. I'm on the United Nations website. You can find it there if you want to look over it yourself. You know, I'm trying to find more information, do some digging, and find more information about this UN declaration that I did a video on one of my previous videos. I'm trying to find more information so I can do an update video, and I just happened to come across this article. But again, you know, a lot of people just jump at the chance to, you know, and just do what they're told, and people suffered, and people, you know, for what people had to go through. And you reading this article, it just seems like they made it worse. It didn't really help anyone, right? They caused a more dangerous situation. You know, they made it. It just seems like they made a problem worse. I mean, that's just, again, this is just how I see it, and I can't help but one of his. It's all by design. You know, I feel it's by design, but I don't want to influence anybody's opinion who's watching this video. I want you all to do your own research and think about it for yourself and form your own opinion. You know, right? And then, you know, I mean, and then we can engage in dialogue and you know, see if we can get make the picture a little clearer as far as what has happened and what's going on right now. You know, communication is important, right? But anyway, that's all I got for this video. Stay informed, love yourself unconditionally, keep your loved ones close, protect the babies, protect the women, right? Go over your plans. Get prepared. Stay prepared. Have multiple plans. Stay ready for the just in case. So just in case something does happen, you are prepared for it. You don't want to get caught unprepared, right? So when something happens, you got to rely on someone else to help you. And you have to face facts. If something serious happened on a major scale, you might not get any help, even from those who you may think will help you and give you a helping hand. Because many just might have the mindset of, you know what, is every man, woman, and child for themselves. You know, so you don't want to get caught in that situation, needing help, and there's no one to help you, right? So that's what this is about. That's what my videos are about. All right. Shout out to my subscribers. Appreciate each and every one of you. For those of you who are new, if you haven't subscribed, please do subscribe. Check out my previous videos. Click the notification bell. Click all, so that you'll be informed every time I drop a new video. Please do like the video, give a thumbs up, and comment. Let me know what you think. What's your opinion on this matter? All right, that's all I got for you. This is King B. Till the next video. Peace.